Hey doctors, I noticed my skin has been looking really pale lately. I miss that glow I used to have. Why is that, and do I need to worry?
Well, today we're talking about hints that your body is telling you, and skin color is so important. You don't have to be a doctor to look at somebody and say, boy, your color looks great, or wow, you look pretty pale. So the first color we want to look at is white or pale. And what is that telling us? Well, virtually any organ system of the body, if you had a problem with it, may present as a pale appearance. Your heart, if your heart isn't working properly, you may appear pale. Your lungs, if you're not moving oxygen, carbon dioxide properly, you may appear pale. You touched on anemia. If somebody was anemic, they don't have enough oxygen, they don't have that rosy look to their face, they're going to appear pale. And then moving on, if somebody appears yellow, you already touched on it, Dr. Travis, that typically the first thing you think about if somebody is yellow is liver problems because you're jaundiced, and that's the buildup of bilirubin, a byproduct of red blood cells.
That's right. And then moving down the color scheme of what your skin could be, if it has a greenish hue, the first thing we think about is nausea. People always say, oh, you look nauseated if you have that little greenish hue. Sometimes, again, it can be another form of anemia, hypochromic anemia, where there's less hemoglobin. But mostly, if it's starting to move to blue, that's where anemias and lack of oxygen can actually come in. And we call this cyanosis when it has this blue ashen type of color. And this is when there's a poor exchange of oxygen to the cells, and that can occur because of heart problems, because of lung disease, asthma. Anytime there's a poor exchange of oxygen, your heart's involved in that and your lungs. So really, really important, especially if you have that blue color.
And a lot of people wonder, what about red? And there are different causes for reddening skin. In general, it means an increase of blood flow to the skin, but it can also mean a rash. Rashes can come from many different sources. It can be an allergic reaction, it could be an infection. But the other thing is, if someone's in a hot environment, you have to worry about things like heat stroke, because that's your body trying to dissipate heat as best it can by sending blood flow to your skin. And the other thing we'll often see is people get really red, even in embarrassing situations. We call it skin flushing. And to be honest with you, a little bit of a rosy hue, skin flushing, whether you're embarrassed or not, a lot of times it just means you've got good, healthy blood flow, and there's nothing to worry about. And it's particularly great when some people, you got them, and they just get super flushed, embarrassed, but there's nothing wrong with that.
That's why women put rouge on their face, right?
So we have that little bit of color.
You've got that little red glow on those cheeks right now.
And I think it's not so much your color or your hue that's the concern. As far as body clues, it's if you're undergoing changes to your skin color. If one day it's pale and then a week later you're getting yellow, those are the kinds of things you have to go get it checked out and figure out what's going on.